We started off today's session by evaluating running arthrokinematics, and on this runner you can see that right knee tends to buckle in a little bit. Now, the running pattern with a stomp pattern is actually pretty good, but she has a propensity to stand straight up. You can also see the hips are dropping a little bit as she's running, in addition to that right knee dropping. So we went in the clinic and looked at her squat, completely shifting to the right, and the right ankle buckles in. So there's some problems going on in both the ankle and the hip. Now, we did a squat on the flat floor, and she didn't get very far and is very shaky, so uncoordinated. So we did a heel lift to change the center of gravity. She got a little bit further down with a little more control, and we even elevated it again, which showed better control and better mechanics because the ankle was not involved as much. So we did some manual muscle testing and found out that the glute medius on the right side is completely weak. Here's me testing it again with barely any pressure, and it drops right off the table. The left side, however, is strong, so that lets us know it's predominantly the weak side of the right. Now, interestingly enough, when the glute med gets weak, the hamstrings, semitendinosus, semimembranosus will get tight for compensation. The movement has to come from somewhere. So this is me just doing some soft tissue work on the biceps femoris and semitendinosus, semimembranosus. It feels pretty good because that's her main chief of complaint, right? So hamstring pain. We then moved into some myofascial decompression of the hamstrings, again, just to help a little bit of the tissue extensibility before we get into the exercises. But the most important exercise we got into today is this side plank modified lunge squat. So as if we're in the squatting position, we're dropping that hip down and then pushing up to activate that glute medius. And this was the first time she felt that glute medius work in quite a while. So it's working. Yep, firing right there. Now, we also decided to do this in standing with an external force to push the knee into genivarum, so to activate those glute medius muscles. And as you can see, that's still pretty shaky. So anytime she'd squat, she'd mostly focus on her hamstrings and not the glute medius. Ankles were a little stiff, so we did some joint mobilizations. Ankles were a little unstable, so we worked on ankle stability, and she's doing very well here. But the most important exercise that you can do throughout the day is our lateral monster walks, toes straight, to get that glute medius burn. She does still have some tightness in the hamstrings as well as adductor, so some dynamic stretching. And then we modified the squat again, and as you can see, less shifting to the right. So we evaluated her running again, and there was less collapsing of the right knee in. Reach out with any questions. Aloha.